Hi everyone, Dr. Kalaiko here, and today I want to talk about making our community pharmacies an access point for different types of healthcare and social services. So I'm here in Komodo Medical Pharmacy in Bakersfield, California, and I'm here with Sandra Medina, our community program coordinator. And we're going to talk about, ways that the community pharmacy can be more than a place where you're just filling prescriptions. So I think when most people think of a community pharmacy, that's probably the first thing that comes to mind. Yeah, it's a place where I get my prescriptions filled. But it has the potential to be so much more than that. So first of all, your pharmacist has a doctoral degree, and they are the medication expert in terms of figuring out which medicines are going to work best for you. And so they are an accessible resource for you to come up and ask your questions about your medications and about your health in general. And then second of all, a lot of community pharmacies are now providing services other than just filling prescriptions. So more and more pharmacies are providing vaccines, for instance, things like birth control, even HIV prevention, and medications to help you quit smoking. So that's another, resource that you can look for at your local community pharmacy. So now if you are working in a community pharmacy and you get to know your local resources in your area, you have the potential to help a lot of your patients in a lot of different ways. So for example, Sandra, if I'm here to fill my prescriptions today, but I'm having trouble, affording my copay, what are some ways that you can help me out with that?
So there's different types of assistance programs out there for patients that can't afford the medication. So for example, let's say you have commercial insurance, but your copay is very high. What I would do is look online on a website I like to use. I would type in the drug, and there it would tell me if there's a coupon, if there's an assistance program through the manufacturer, or if there's a diagnosis-based foundation. So in this case, if you have commercial insurance and it's just a really high copay, then the coupon would work best for you. But it all depends on the patient's situation. We are there to look for whatever resources available to them, and then just depending on the situation, we'll find the appropriate resource for them.
Great. Now, what about if I need, other services besides medications? Let's say I just came out of the hospital and I need to find a primary care doctor or something like that. What else can you help me with?
So here we have a binder here with some resources. So let's say you have no coverage, you just got out of the hospital. So depending on what your service that you're asking for, so here you said you need to find a doctor. We would find, we'll go under the primary care tab, and then we would look for clinics that are helping patients on a sliding scale because they can't afford their going to a primary care physician because they're having no insurance. So for example, so here in Bakersfield we have a clinic is Sierra Vistas, and there's a multiple locations. So we have one on Chester. So the patient will usually just ask for the phone number, and then they would call the clinic and set up an appointment. Or we can also call it. Maybe the patient doesn't have a phone number. We do have some patients that are homeless. Unfortunately, we are more than happy to call the clinic and make the appointment for them, and then from there the clinic will ask what type of information they're needing from the patient.
Now, what if I have undocumented immigration status? Do I qualify for services like the ones that you're describing?
Yes, so even if you're undocumented, you should qualify for any services. Any low-income patients too, you will not get refused just because of your status here in the country.
So this is all great information. How did you look up all of this info that you have in the binder?
So it just depends. Sometimes it's word of mouth. People will let me know about the different resources, and other times I actually have to look for the information. So I would go to Google, and then whatever information I feel like people would need. So anything from food assistance, finding assistance to pay for your rent, and even assistance with domestic violence. We do get some patients that they confide in us, so we will help them look for whatever resource to help them, because the thing is that a lot of people don't know that health it is affected by numerous factors. Even not having an adequate good environment for their children to play in, like good parks. Even having sidewalks. It all affects patients in a number of ways.
Well, thank you so much, Sandra. So it sounds like, through the community pharmacy that we have the potential to help patients in a much more comprehensive way to, improve their health. Other than just filling prescriptions, we can really look out for their other social needs and be a resource to refer them to the local assets and community-based organizations that can help them with those various needs.
Yes, so if you know anybody, if you need help or anybody that needs help, send them our way. We'll be more than happy to help them out. We're here for you.